Hypericum Perforatum, commonly known as St. John's wort, is a cornerstone remedy in homeopathy, renowned for its powerful effects on nerve-rich areas. Prepared from a fresh flowering plant, the remedy undergoes a meticulous process of tincture preparation and potentization to amplify its healing properties. Often referred to as the arnica of the nerves, it excels in treating injuries involving the fingers, toes, spine, and other sensitive nerve-dense regions. Sharp shooting pain. Pain radiates upward from the site of injury with great intensity, hypersensitivity to touch. Even the lightest pressure causes excruciating pain. Nerve injuries, effective for crushed fingertips, puncture wounds, spinal injuries, and other trauma involving sentient nerves. Worsening factors. Symptoms are aggravated by touch, movement, cold, damp weather, fog, or lying in bed. Relieving factors. Pain eases when lying on the stomach, bending backward, or with gentle rubbing. Fear of falling from heights, often associated with anxiety or a sense of being lifted high and losing balance. Melancholy and nervous depression, particularly after injuries or traumatic events. Forgetfulness, difficulty focusing, making mistakes in writing, or forgetting intended actions. Pain often radiates upward from the injury, exquisite sensitivity that appears disproportionate to the wound's visible severity. Emotional symptoms mirror nerve sensitivity with restlessness and agitation. Hypericum is indispensable for both acute and chronic scenarios involving physical injuries and emotional trauma. Injuries. A carpenter accidentally hits his thumb with a hammer, causing sharp radiating pain up the arm. Hypericum quickly alleviates the discomfort and prevents complications like nerve damage or tetanus. Children. A child falls off a swing, landing on their tailbone, resulting in pain radiating up the spine and reluctance to move. Hypericum addresses both the physical and emotional distress. Postpartum care. A woman experiences sharp Coccyx pain and irritability following childbirth. Hypericum soothes the nerves and aids recovery. While Hypericum has overlapping indications with other remedies, it stands out for its focus on nerve injuries. Arnica, ideal for general bruising and muscular trauma, but lacks Hypericum's specificity for nerve-rich injuries. Ledum, effective for puncture wounds with localized cold pain, but not for ascending nerve pain. Staphysagria, suited for clean incised wounds or emotional humiliation, but less effective for crushed or lacerated nerve tissues. Ruta, preferred for ligament and tendon injuries unless nerve involvement dominates. Nervous system, nerve-rich injuries, fingers, toes, nails, neuralgia, neuritis, tingling and crawling sensations. Prevention and management of tetanus symptoms such as lockjaw, spinal injuries, falls on the coccyx with radiating spinal pain, spinal concussions and whiplash injuries, emotional trauma, shock, fright or grief following physical or emotional injury, nervousness, irritability and restlessness. Post-surgical care, relieves nerve pain and hypersensitivity after operations, prevents complications like infections and nerve inflammation, skin and scars, painful tender scars in nerve-rich tissues, eczema with intense itching, herpes zoster. Ascending neuritis. Inflammation or pain from injuries often travels toward the brain or spinal cord, exemplifying Hypericum's ability to halt such progression. It's fascinating how this remedy can intercept the pain pathway, providing relief and preventing further complications. Asthma of psychological origin. Hypericum addresses asthmatic attacks triggered by emotional or psychological shocks, often linked to past injuries. This is particularly beneficial for individuals whose respiratory issues are rooted in their mental and emotional well-being. Head trauma, effective for headaches and neurological symptoms following concussions or spinal injuries. Hypericum's role in alleviating post-traumatic symptoms is invaluable, offering a natural alternative to conventional treatments. Epilepsy, for seizures arising after nerve injuries or spinal trauma. Dosage and administration. For internal use, potencies such as 30C or 200C are common. Administer 30C every 2 to 4 hours for acute injuries until symptoms improve. Higher potencies like 200C are reserved for more severe or chronic conditions. Case studies: puncture wound. A shoemaker stepped on a rusty nail, experiencing sharp radiating pain. Hypericum alleviated the pain and prevented tetanus. Dental nerve pain. A patient undergoing dental surgery experienced severe nerve pain. Hypericum provided rapid relief and accelerated recovery. Spinal injury. A man who fell on stairs and injured his coccyx had pain radiating up the spine. Hypericum resolved the pain and prevented chronic complications. Tetanus prevention. Following a dog bite and symptoms of lockjaw, Hypericum reversed the progression and provided a complete recovery. Asthmatic attacks. A patient with spasmodic asthma triggered by emotional trauma responded dramatically to Hypericum, alleviating symptoms and preventing recurrence. Conclusion: Hypericum Perforatum is an essential remedy for addressing nerve injuries and related symptoms. It alleviates sharp, radiating pains, hypersensitivity, and emotional distress, embodying the holistic principles of homeopathy. From acute injuries like crushed fingertips to chronic conditions such as post-concussion headaches or neuralgia, Hypericum offers profound relief and prevents complications, making it a cornerstone remedy for both physical and emotional healing. Its remarkable ability to address nerve-related conditions ensures its continued relevance in homeopathic practice. Disclaimer: this information is provided for professional homeopathic practitioners only. The author assumes no responsibility or liability for any misuse or improper application of the remedy. This remedy should only be used under the supervision of a qualified homeopathic practitioner. That's all for today. Do you know what holistic treatment is? Do you think we should try homeopathy? Feel free to share in the comments below. If you'd like to learn about new remedies, let me know in the comments and I'll do my best to cover them as soon as possible.